everyone. It's wonderful to be here. I'd first like to thank Bill Dietz for his many years of inspiration to us at the National Business Group on Health and our work on obesity, Becky Johnson, and all the members of the Obesity Roundtable for keeping this issue front and center and for your solutions, especially policy solutions-oriented approach. So the business group, let's see, I've got 2 slides. We each have 2 slides. Well, you know that. You can figure out how. There we go. So the business group represents the largest self-insured employers in the U.S. And globally. We have a global group as well, focusing on the U.S. today. So our membership, we're a membership organization, 73 of the Fortune 100. Most of our members are Fortune 500. We do have some notable public employers who are members, including OPM, the state of Tennessee. You can see this is just a sampling of our members. They include healthcare delivery systems, as well as large health insurance providers, but primarily coming together as purchasers of healthcare services on behalf of their employees, about 50 million total. And also as organizations who want to network and share best practices on improving workforce well-being. So how employees are doing at work, their overall holistic well-being significantly affects workforce effectiveness, work performance, productivity. So that's what we work on together. I think the important thing to note here is that what we thought of as employee wellness is undergoing a shift in the market, and we're helping lead that and drive that toward a more holistic view of well-being that includes additional dimensions beyond physical health. So most of what I talk about today will focus on physical health because it's about obesity prevention and control, but the companies are focusing on financial security in the wake of evidence that many employed people have significant stress due to not being able to pay their bills. So there's financial security, there's emotional well-being, social and community connectedness, and job satisfaction, or in Gallup terminology, career well-being. So those are all of the dimensions that are part of these efforts. And what that does, I would add as a corollary, is that rather than look at ROI on medical costs, the measure of success is also being reframed to what is the impact on business performance, measured in terms of things like, of course, as always, absenteeism and safety incidents, but employee engagement, recruitment and retention, and increasingly business-specific metrics around customer satisfaction, sales, and so on. Okay, next slide. And the physical health programs that large employers are offering are robust, have been growing over many years. Bill and I started working together on this obesity issue in the workplace in 2003. We've seen a great expansion in breadth and depth and sophistication of what is being offered by large employers. And you can see at the very top of the list, certainly having a moment, our physical activity challenges, and we've heard them mentioned several times today, with or without a supportive device like a Fitbit. But certainly that's an important engagement strategy. Tobacco cessation, number 2, weight management programs. Another trend I'd like to call out is that companies are increasingly looking to include families. So in the, let's see, what percent is it that offer? In the 78% who offer weight management programs, 84% of those offer them to spouses and domestic partners. And there's also an interest in extending programs where possible to families. Other trends would be, I think a lot of times we associate wellness programs with incentives, and in fact, unfortunately, some people think those terms are synonymous. Wellness programs equals wellness incentive. And definitely there's been a pulling back on the use of incentives and a decline in the use of outcome-based incentives. While incentives are still important, they're being redefined to include, in many cases, not just individual financial rewards, but non-financial rewards, group incentives, group rewards, and also donation of awards into the community. So that's another important trend that we're seeing. Let's see, how am I doing on my, I'm right at 5 minutes. Maybe I'll save the rest for questions.